Wet Swanepoel is a South African innovator whose work has reshaped hearing care around the world. A professor at the University of Pretoria and founder of the hearX group, he helped turn the smartphone into a medical-grade device for hearing testing and ear imaging. What began as a South African solution has now been adopted globally. Hi, Prof. So nice of you to join us today.
Hi, Linda. It's good to be with you.
So let's start from the beginning. How did it all start? Why the interest in that? And tell us what you developed.
Yes, Linda, I've always been interested in seeing how can we get hearing healthcare to where people are at. Hearing loss is much more common than people realize. Globally, 1 in 5 people have a hearing loss. And the reality is that 90% of those are not able to get the hearing healthcare services they require. So back in 2012, I was serving on a Department of Health implementation committee for the integrated school health policy. And we were looking at how can we implement this policy to screen 1 million grade 1 pupils' hearing every year in South Africa. And I looked around at the technologies and the shortage of professionals available to do that kind of testing. And I just realized it's going to be absolutely impossible. And it was at that stage that I saw mobile kind of changing so many industries, right? It was changing banking, it was changing agriculture. And I just realized that if someone can do banking on an app in a rural village, why can't we also offer a hearing test for someone on their own smartphone device in that kind of setting? So that's kind of what triggered it. And that started me on the process of doing the research, doing the due diligence, connecting with the right people to really develop this array of solutions running on a mobile phone.
Well, for people who might not know what they are, can you list them for us? So what tools and apps do you have?
Yes, sure. So the first thing we actually developed was a hearing screening application that ran on a 500 Rand Android smartphone. That was our breakthrough technology and innovation that we patented. And it was allowed us to have a medical grade screening technology that runs on a mobile phone. But because we were using mobile phones, it also has the features of automation. And we wanted to have anyone should be able to actually facilitate the test. So the idea was to make it extremely simple. So the user interface is really easy. Even people with minimal literacy are able to actually facilitate the screening test. And that allowed us to give this to community health workers, to teachers, nurses, to do the screening in schools on that mobile device. And that the first application was called hearScreen. It's still available. It's used globally as a screening audiometer to screen the hearing of young children, but also adults. And the whole idea is we don't need to have people come into clinics. Now we can take the screening to schools, to community centers, and especially also in low-income settings. At the same time, we wanted to see how can we have a consumer application that anyone can download onto their own smartphone and do a hearing screening on. So there we had to look at a different type of technology. So we were looking at presenting speech signals in noise. We chose digits because digits are universally known, and even children can respond to digits. So we used digits from 0 to 9. And you hear 3 digits, and in the background there's noise. And then if you get the digits correct, the noise gets louder. And if you get it wrong, the noise gets a little bit softer. So we're testing your ability to hear speech in background noise. That technology we eventually, got working on mobile phones. And then subsequently we released that as the national hearing screening test in South Africa in 2016 on World Hearing Day. It was a massive success, screened tens of thousands of people in those first few days. And off the back of that, the World Health Organization actually contacted us and asked us, can we use that technology to develop an application for them that uses the same technology? So we developed the official World Health Organization screening app called hearWHO. That's freely downloadable. It's been used in more than 190 countries around the world. And, close to 1 million people have already taken the test around the globe. So yeah, truly a global impact if we can get these solutions onto people's phones.
Well, it's amazing how a South African idea ended up shaping international hearing care strategy. So, how else are you involved internationally?
Yes, so we've expanded the range of technology. So we've got the screening technologies, the hearScreen, we've got the consumer applications, but we also wanted to do diagnostic testing from these mobile devices. So again, not having people needing to come to professionals, but taking the services to them. So we developed subsequent diagnostic tests, two of these, one called hearTest, which is just the diagnostic version of hearScreen. So now we could test, for example, in occupational health settings where people need to have their hearing tested every year at least to make sure that they don't have any damage due to noise. But it also allowed us to offer the solution to for clinical trials, for example. Pharmaceutical companies who needed to do trials on people could now actually do the tests on people's hearing to check if there's any influence of the drugs on hearing, and they could do that in their homes or they could do that in community-based settings. But we also developed a little device that you can plug into the phone, put it into your ear, and we can visualize the ear drum and ear canal. And then I worked with my partners at the University of Pretoria to develop an AI algorithm that helps us then to identify and classify what we see on that image into a couple of categories, whether you have a normal eardrum or do you have an ear infection, or is it just a wax compaction, or is it an other abnormal category that you need to be referred to for professionals. So that was called the hearScope. So those are some of the other solutions. We also eventually, Linda, moved into hearing aids. Of course, the whole idea is we wanted to identify hearing loss, but also diagnose, but we also wanted to provide the treatment.
Well, let's talk about hearing aids because, when you start looking for your elderly parents for hearing aids, they are exorbitantly expensive. So what can be done to bring down this price and make it more accessible and possibly, get something over the counter or order it from the internet?
Yes, Linda, you're absolutely right. One of the biggest barriers for hearing aids is the cost. They're extremely expensive wherever you go in the world. In the US, the average cost is $4,500 for a pair of hearing aids. So there's an access issue there. And it's not surprising, therefore, that in Africa, less than 2% of people who need hearing aids are actually getting them. So it's a tremendous problem. But even in places like the US, we know that only 20 to 25% of people who need hearing aids are actually accessing them. There's a lot of reasons for that, but certainly cost is one of the major barriers. So through hearX, we wanted to really offer the full range from screening, diagnostics, but also intervention. But we didn't want to do this in the conventional way. There's already, clinics, there's already big hearing aid manufacturers. So there was regulatory allowances in the US that they announced in 2017, 2018, that over-the-counter hearing aids was going to become a possibility in the US. No one knew when and how. But because we'd already developed this ecosystem and the infrastructure to offer hearing testing on a mobile device and to have applications for hearing healthcare, we were in a unique position to really, capitalize on the opportunity. So we worked closely with one of our early investors who invested in hearX, Bose Corporation. They actually wanted our hearing test technology because they were interested in developing hearing aids as part of the over-the-counter hearing aid transformation in the US. But eventually they decided to partner with us and just provide us some of their unique sound technology so that we could actually sell hearing aids in the US at a fraction of the cost of traditional hearing aids as part of this over-the-counter launch. And of course, these technologies were now powered by Bose, and that's a consumer brand that people recognize. So yes, we had a really successful launch in 2022. hearX had hearing aids in 11,000 stores overnight, offering these devices in a whole new way. So the idea was you buy a pair of hearing aids. You can either order it online or you can order it or buy it over the counter at a pharmacy. And then you download our application. You do a hearing test through the hearing aids. And then based on that hearing test through our application, you fit those hearing aids and customize it to your hearing in the comfort of your own home. And that's been a revolutionary change in the industry that has really allowed people to access hearing aids, good quality devices at a fraction of the cost.
Wow, so that's in the US. So the FDA allowed that. What about other countries? What about the UK? What about South Africa?
Yes, that's a good question. I think, other countries around the world are all looking at how can they accommodate these types of over-the-counter hearing aids. Some countries already allow them. I think in Australia, for example, they don't have a heavily regulated hearing aid landscape. In the UK, increasingly, this is becoming a priority because the NHS has such long backlogs and waiting lists, and alternative models are becoming increasingly important even there. So it's certainly being investigated. I know in South Africa as well, our Health Professions Council currently looking at how this model can coexist with existing medical models, because the whole idea is it's not there to replace a medical model, but it's just to offer an additional channel for people to access devices early on. I think we've actually had some interesting move from consumer players as well that are also opening up this landscape for us. The one of the biggest companies in the world, recently mentioned as the most valuable consumer company in the world, Apple, released their over-the-counter hearing aid last year through their AirPods Pro series of devices. So literally a software change overnight, and allows people with their AirPods to now also get the benefit of amplification.
Oh, you seem to have changed the world, how the world thinks about hearing care. So what's next for you? What are you working on? What can we expect from you?
Linda, I think we are certainly looking at, continuing the innovations around these technologies. One of the things we've just released recently is a version that also runs off a mobile phone, but with a little piece of hardware that now allows us to do screening for newborns. So it's a little probe we put into the ear. And the technology has been around a long time, but again, it's been really expensive. It's been difficult to get, difficult to operate. And we've now put it onto a mobile phone so that pretty much anyone can operate it, facilitate this screening test. The test takes a minute per ear, so really quick and very accurate. And it allows us to now also ensure we can actually screen the youngest people in our populations. If a young baby has hearing loss, if we don't identify it, it changes the entire course of their life. And if we can identify it, we can secure for them, a developmental trajectory that's on par with normal hearing peers. And so that's something we're driving also in South Africa to ensure that more babies get their hearing screened and are able to access the amazing benefits of the hearing technologies and amplification technologies that we have at our disposal. So that's one of the areas we're focusing on. We also have a foundation called the hearX Foundation. So we do a lot of innovative work through the foundation as well in low-income communities. We just launched a really exciting application now on World Hearing Day on the 3rd of March, where we offer a free training program, an AI-enabled training program on WhatsApp to any preschool teacher or school teacher or assistant. So you literally, WhatsApp a number and then you can enroll onto this program. We've designed it so that it's 4 micro modules on how to identify hearing problems in young children. And if you identify them, what can you do about it right there and then in the classroom? And also, where can you send them to so that they can get the help they need? And then other intervention strategies for teachers. Teachers are the gatekeepers of the education system. So they're really in a unique position to identify children who struggle with hearing loss, and it can make a tremendous difference. So we launched that 3rd of March. We have already had 10,000 teachers trained through this module, and we're doing a little questionnaire beforehand and one afterwards, so we can actually measure the impact of this training. And we're seeing significant improvements in their knowledge and their awareness about hearing loss, and also the strategies on how to help kids. So that's just another really exciting venture that we're busy with to raise awareness in school settings.
So can we just quick to end off and look at the business models? Are you a spin-out from the University of Pretoria?
Yes, so hearX is a tech spin-out from the University of Pretoria. So with my co-founder from computer engineering, we licensed the technology into a private company in 2016. Started in 2016 with entrepreneur co-founder we brought onto the team, Nick Klopper. And from 2016, we were a company, 2 employees that we started with, but the company has steadily grown. It's a venture-backed company. So we've had investment rounds from various places around the world and different companies that have partnered with us. And, now it's a company in Pretoria that has close to 250 employees, and that serves a global footprint of hearing healthcare services and professionals, but also consumers around the world.
Do you have investors?
Yes, so we have a range of investors, Linda. So we've had an angel round, Series A, Series B. We recently had a Series C funding round, and we also merged with a US hearing aid manufacturer, also in the over-the-counter space, and now also headquartered in the US. Most of the operations happen in South Africa. Most of the people work from here, but the executive team currently sit in the US.
Well, lastly, just some advice for people how to protect their hearing, because we always think of teenagers telling them they listen to their music too loud. That's one of them. So are there other tips you can give to people how to protect their hearing?
Yes. So, hearing is one of those things that we take for granted, right? It's integral to who we are as humans. It's what connects us to the world around us and to people around us. So you only realize how important it is once you lose it. So it's really good to ask that exact question, Linda. What can we do to take care of our hearing? I think the number one preventable cause of hearing loss is loud sound. So here, I think the messaging needs to be careful. We don't want people to feel like they need to be away from sound. Sound is good for us. It's what we enjoy, but it's about how do we manage the exposure, We don't want to be exposed to too loud sound. So if you're in an occupational setting, or you have hobbies that, have really loud sound connected to it or noise connected to it, ear protection is really important. So we always encourage people to wear hearing protection. The problem with hearing loss due to noise is that the damage sets in and you're only aware of it 5-10 years down the line. So it's not immediate. So it's best to protect it early on. And then for youngsters, the WHO has a really big campaign, a public awareness campaign about safe listening practices. We live in a world where youngsters, are listening to music all the time with earphones, and they listen to it at really loud volumes. And their advice is just to listen at safe levels. If you do want to crank it up a little bit, do that for short periods of time, but generally make sure you keep the volume at a safe level, and then take listening breaks. If you're listening to loud music for a long period of time, make sure you also work in regular breaks where you just give your ears some time to just recover.
Wet Swanepoel from hearX and a Prof at Tuks University. Thank you so much.
Thank you, Linda. It was good to be with you.